Start. Welcome back guys. Now let's discuss about the acid-base disorders. In the previous video we have discussed about the acid-base balance, right? How kidneys are trying to maintain the pH. Now let's see what are these acid-base disorders. First of all, tell me what is the normal pH. The normal pH is in the range of 7.35 to 7.45. This is considered as a normal. Okay. Next, if a pH is less than 7.35, we all know if the pH value is less than 7.35, it is considered as acidosis. Okay, acidosis. If a pH value is greater than 7.45, it is considered as alkalosis. Done. Next step, what is a normal PCO2 value? See, PCO2 value is 35 mmHg to 45 mmHg, means the amount of carbon dioxide in your blood, 35 mmHg to 45 mmHg. Always remember, this carbon dioxide is a function of respiratory system. So carbon dioxide is always something related to respiratory. Carbon dioxide means acids. Okay. So always remember, carbon dioxide is the source of acid and carbon dioxide is a function of respiratory system. How much carbon dioxide is maintained in our body is determined by our respiratory activity. Okay. Next up, bicarbonates. HCO3 minus. Value, the normal value of a bicarbonates is 22 to 28. Okay, 22 to 28 milli equivalents per liter. Some books mention 22 to 26, but 22 to 28 milli equivalents per liter can be considered as normal. 22 to 28 milli equivalents per liter. Okay. Remember, the bicarbonate production is the function of our metabolic activity, or you can say bicarbonates is the function of our metabolism. Metabolic. So everything about bicarbonates I am going to use the word metabolic. Okay. Bicarbonates are considered as buffers, or you can say bases. Okay. Now tell me what is the normal carbon dioxide value, 35 mmHg to 45 mmHg. Carbon dioxide is the source of acid, bicarbonate is a base. For bicarbonates I am using the word metabolic, for carbon dioxide I am using the word respiratory. See, you will get the clarity, just follow. Now whenever you have to solve, okay, whenever you have to solve acid base disorder question, first always you have to check pH, whether pH is normal or not. For example, look, now I am giving a disorder where, let's say there is a patient whose pH is 7.2. Okay, pH is 7.2. The partial pressure of carbon dioxide is, let's say, 55 mmHg, and the HCO3 minus bicarbonate value, let's say 25 milli equivalents per liter. Now they will be asking you, what is this disorder? What is this metabolic disorder? So first always you have to check pH. Let's start with the pH. Now pH is definitely less than 7.35. So definitely my patient is suffering with acidosis. No doubt the patient is suffering with acidosis. Okay, diagnosis completed, he is suffering with acidosis. Now question is this a respiratory acidosis or metabolic acidosis? Because acidosis is of two types, respiratory or maybe metabolic. So now tell me, is it a respiratory acidosis or metabolic acidosis? Now you have to check the values of PCO2 and bicarbonates. Now see, PCO2 value, PCO2 is nothing but acid, right? PCO2 is nothing but acid. Bicarbonate is nothing but a base. So now in this condition, what happened to the acid value? 55 more. Now there is more acid. Then what about the base, guys? Base is normal. 22 to 28 is normal. So this is a normal, here it is a normal. Now tell me, so this acidosis, is it because of this PCO2 or is it because of this bicarbonate related problem? It's definitely because of PCO2, right? So I have told you, whenever there is any problem in the PCO2, you have to use which word? Respiratory. Now here there is more acid production. So this is respiratory acidosis. Respiratory. So you can say, in a patient who is suffering with respiratory acidosis, always the PCO2 value should be more. So respiratory acidosis means what? PCO2 value will be high. So PCO2 value, whenever it is increasing, respiratory acidosis. Okay. But kidneys, are they trying to compensate? No. Bicarbonate is not changing, it's not, still compensation not happened. So this is the respiratory acidosis without compensation. Okay, the kidneys are not doing anything in order to change the pH. Okay, now let me give you, so first example number 1 completed. Okay, now let's look at the example number 2. Example number 2. Again, same patient with the pH of 7.2. PCO2 value is, let's say, 40 mm Hg, and HCO3 minus is 19 milliequivalents per liter. 19 milliequivalents per liter. So now tell me, first what you have to check, always check for the pH. Now again, the pH is less than 7.35. Without doubt, the patient is suffering with acidosis. Okay, without a doubt, acidosis, sir. Okay, now whether this acidosis, is it because of the carbon dioxide or is it because of the bicarbonate problem? Look, carbon dioxide is normal, 35 to 45 normal. There is no problem with the bicarbonate. There is no problem with the carbon dioxide. But look at the bicarbonates. Sir, now his bicarbonates are less. So bicarbonates, that is base, is now less. Normal value was supposed to be between 22 to 28. Now in this condition, bases are decreasing. So now the base value is decreasing. The base value is decreasing. So when the base value is decreasing, so relatively acids will be more, no? So now tell me, this is a base related problem, that we are losing the bases. So this is metabolic. So any problem with the carbon dioxide, respiratory. Any problem with the bicarbonate, metabolic. So this is metabolic acidosis. So what is the most important thing in the metabolic acidosis? In metabolic acidosis, the bicarbonates, HCO3 minus, will be less. Bicarbonates are decreasing. Done? So this is simple. Now let me give you a few more examples for better understanding. Guys, look, example number 3. Let's say in a patient, pH is 7.5. Okay, 7.55, let's say. Now, what is his PCO2 value? The PCO2 value and HCO3 minus values. Look, the PCO2 value is, let's say, in this condition, 20 mm Hg, and bicarbonate value is 25 milliequivalents per liter. Now, very simple. Now you tell me, the pH is more than 7.45. So definitely this patient is suffering with what? Alkalosis. Without a doubt, the patient is suffering with alkalosis. Now tell me, this alkalosis is because of what? This alkalosis, is it because of carbon dioxide related problem or bicarbonate related problem? Now look, the acids in this condition, the PCO2 acid is decreasing. There is less acid. In this condition, there is less acid. Okay, less PCO2 means less acid. So now tell me, ask yourself, less acid, is it going to cause alkalosis? Whenever your acid level decreases, will it cause alkalosis? Yes. More acid means acidosis, less acid means alkalosis. So yes, this is respiratory alkalosis. Okay, respiratory alkalosis. So whenever your PCO2 is decreasing, okay, whenever your PCO2 decreasing, that is respiratory alkalosis. And what about the bicarbonates in this condition? The bicarbonates in this condition is normal. So it's not a metabolic problem. It's a problem with carbon dioxide. Okay, this is respiratory alkalosis. Now let me go into little bit more complex, okay, disorders. Bit more complex disorders. Now let's say patient number 4. Patient number 4. Now what is the pH? The pH is 7.55. Let's say 7.55. Now PCO2, how much? HCO3 minus how much? PCO2, let's take 20 mm Hg. Bicarbonates are also 20 mm Hg. 20 milliequivalents per liter. 20 milliequivalents per liter. Now this is bit complicated, but very easy. So follow our rules. First, look at the pH. More than 7.45. So definitely alkalosis. Alkalosis. The patient is suffering with alkalosis. Without any doubt, the patient is suffering with alkalosis. Fine. Now, this alkalosis Is it because of carbon dioxide related problem or bicarbonate related problem? Okay. Now, first check the PCO2. Now, PCO2 in this condition is 20 milliequivalents per, that's at 20 mmHg. So, write less acid. Here acid levels are less. Okay. Next, look at the bicarbonate. Bicarbonate is also less than 22. So, less base. Now, ask yourself a question. Ask yourself, here acid is less. Whenever there is less acid, will it cause alkalosis? Ask yourself, whenever there is less acid in the body, will it cause alkalosis? Yes, yes, it will cause alkalosis. But whenever there is less base, whenever your bases are decreasing, will it cause alkalosis? No. Whenever your base is less, it will cause acidosis. So now tell me, this is not the reason for the alkalosis. This is the reason for the alkalosis. Now this alkalosis is because of less acid. So this is respiratory alkalosis. Okay, respiratory alkalosis. Now you will get a question. Then why these bases are decreasing? Why the bases are decreasing? Okay, already the patient is having alkalosis, no? So during alkalosis, the kidneys are trying to compensate. Already the patient is suffering with alkalosis, sir. So during alkalosis, have I taught you? Kidneys will compensate. Kidneys excrete more bases during the time of, look, okay, let's go back. Look at here. During the time of alkalosis, what your kidneys will do? Excrete the bases. Your bases also decreasing, trying to compensate. Okay. So now here I can say the patient is suffering with a respiratory alkalosis, getting compensated by the kidneys, So this is not the reason for the alkalosis. The reason is less acid. So now let's look at the patient number 5. Now, what is the pH, guys? Here the pH is 7.55. Again, same 7.55. Now, what is the PCO2 value? PCO2 and HCO3 minus. The PCO2 value in this condition, let's say 50 mmHg, and bicarbonates, let's say 35 milliequivalents per liter. Now, tell me, definitely the pH is more than 7.45. So here it is alkalosis, without any doubt, alkalosis. Now, is it respiratory alkalosis or metabolic alkalosis? That's the question. Is it respiratory alkalosis or metabolic alkalosis? Now, look at the PCO2. In this condition, acid is more or not? Yes, there is more acid, right? There is more acid in this condition. Okay. And what about the base? 35 milliequivalents per liter. Base is also more. There is more base. Now, ask yourself this question. Ask yourself. Now, whenever acid increases in your body, will it cause alkalosis? Whenever there is more acid, it will cause acidosis, not alkalosis. So, definitely this is not the reason. For our alkalosis. Now, second question, ask yourself. Whenever your base levels increases, whenever your bicarbonate increases or basis increases, will it cause alkalosis? Yes, it will cause alkalosis. So, this is our metabolic alkalosis. Metabolic alkalosis. So, this is the reason. Now, there is more bicarbonate. This is the reason for our alkalosis. Okay. Now, tell me, sir, whenever your base is more, that will lead to alkalosis. Then why the acid is increasing? Because trying to compensate. Here the person is having alkalosis, right? In order to compensate, acid levels are also increasing. There is more base, right? In order to compensate, acid is increasing. The lungs are trying to increase the acid. Okay, increase the carbon dioxide, trying to compensate. So this is how you have to find out whether a disorder is first of all acidosis or alkalosis. Is it respiratory acidosis or metabolic acidosis? Is it getting compensated or not getting compensated? See, in this condition, the person is suffering with alkalosis, and this alkalosis is getting compensated. Okay, at least partially getting compensated with the help of this lungs. Now, last example I am giving you. Let's say the patient pH is 7.28. The PCO2 value, HCO3 minus value. How much PCO2? The PCO2 value, okay, 50 mmHg. Bicarbonate value, how much? Bicarbonate value, let's say it is 35 milliequivalents per liter. Now, you tell me, 7.28 Definitely without any doubt, acidosis. Which acidosis? Respiratory or metabolic? That we have to find out. Look, in this condition, PCO2. Increased or not? Yes, increased. There is more acid. Next, base is also more. Ask yourself a question. Sir, whenever acid increases, will it cause acidosis? Whenever there is more acid, will it cause acidosis? Yes. Yes. Now ask a second question. Whenever base increases, will it cause acidosis? No. Whenever base increases, it will cause alkalosis. So, this is not the reason for our acidosis. So, this is respiratory acidosis. Respiratory acidosis. Okay, respiratory acidosis. Then why the bases are increasing? Why the bases are increasing? Compensation. So, this is how to identify. First, identify whether the patient is having acidosis or alkalosis. Next step, identify whether it is respiratory acidosis or metabolic acidosis. Next, you have to identify whether it is getting compensated or not getting compensated. Okay, or partially getting compensated. So, see, here in this condition, the patient is having acidosis. In order to compensate this acidosis, the bases are increasing. Yes, getting compensated. So, whether it is getting completely compensated or partially compensated, that we will discuss in the subsequent videos with the help of a Winter's formula, etc. Okay. So, in this video, I have gave you a basic understanding how to identify a acid-base disorder. Hope the video is helpful. Thank you.